Greetings everyone, my human family. I'm here with Dr. Jason Regis from the Transformation Wellness Team. And today we're going to have a question and answer session about chiropractic care. Dr. Jason? I've been actually with Dr. Jason for close to 7, we're going on probably 8 years at this point. And he was the first chiropractor I've ever seen. And after that, I hardly ever go to any doctors besides Dr. Jason, because pretty much everything that, any ailments I might have, he's been pretty much able to take a look at it, find out, tweak it, and tell me what I need to do. And not only does he do chiropractic care, but also he helps along with nutrition and numerous other parts of just homeopathic health. Okay, so Dr. Jason, I'll let you go ahead and introduce yourself.
I'm Dr. Jason Reese with the Transformation Wellness Team. We've had this building for about 3 years now. I've been a lifelong student of health. Both my parents are actually medical doctors, and so is my younger brother. I chose a different path of prevention and care, and also helping people to get better with a non-invasive approach. Answer their questions, find out the root cause of the problem. Doctor of Chiropractic stands for, DC stands for Doctor of Chiropractic, also stands for Doctor of Cause, and I like to say Doctor Coach as well. I like to coach you into health and teach you what to do to stay out of the office and come into regular maintenance and care and being proactive about your health. Got started back on September 18th, 1895 in Davenport, Iowa, was the birthplace of chiropractic. There was a gentleman, Harvey Lillard was his name, and 17 years he had partial hearing, so almost deaf. And previously he had been crawling through a small space and heard a pop in his back. And ever since then he had lost his hearing. So fast forward to 1895, the founder of chiropractic, D.D. Palmer, was studying necks and bodies and spines, and he noticed that people with smoother necks were healthier. People with bumpy necks, meaning the bones were out of place, actually were more sickly. They died sooner, had more ailments. And so he was in a building, and the janitor, Harvey Lillard, was walking around, and he asked Harvey to do an evaluation. So he evaluated Harvey and checked out his neck and found out that the first bone in his body, the atlas, was out of place. And he moved the bone. There was a popping sound, and Harvey Lillard got his hearing back. And that's how chiropractic got started, way back in 1895. It's nothing new.
Oh wow, that's pretty amazing. I had no idea. That's how it started. Okay, great. Okay, another question. So why do you guys work and move with bones?
Well, the reason we move bones is because bones house the nervous system. Your nervous system controls and coordinates everything in your body. It's the master computer. And so it's an extension of your brain, and it goes through your bones into your different extremities, your organs, your arms, your legs, all the above. And so if you notice, the body is designed very intelligently. It has bones around all of your vital organs. You have your skull around your entire brain. You have your lungs around your ribs around your vital organs, such as your lungs, your heart, liver, so on and so forth. So as chiropractors, we work with bones because when bones are out of place, they interfere with the nerve flow as well as the blood flow. We call that a subluxation. So chiropractors remove subluxations with adjustments, which are specifically designed forces that we do with hands to move the bones into place and help the body move and function optimally. Another thing is that your atlas, which is the first bone in the body, which is where the first adjustment was done, is called the master switch. You have your occiput, your skull bone, your atlas, and your axis. So this is the master switch, we like to call. Your occiput, which is the base of your skull, you have your atlas, and you have your axis. And what happens is, this is your cerebellum, your brainstem. Half the nerves, your entire brain, are located in this small little area. And so the atlas was the first bone that was adjusted back in 1895, the axis. And so when these bones are out of place, they pinch on your nervous system and interrupt your nervous flow. And so as chiropractors, we deal with this as the cause of the problem, because also, even with headaches, the blood supply from the heart to the brain goes through the neck, to the vertebral artery here. Might be hard to see, but you can look it up. But anyway, long story short is when these bones are out of place, it's kind of like a water hose. If there's a water hose and water's going through it, and you step on the water hose, what happens to the water? That's right, it stops or slows down. Maybe sometimes goes out a little bit faster. The same thing happens with your nerves and your blood supply. It can cause nerves to be hypersensitive or hypo when you have less sensitivity. And so by dealing with the nervous system, we're able to help with a lot of different issues, but by first removing the interference, help the body move and work and function optimally.
That's amazing. You know, that explains a lot as well.
Yeah, it's all about the structure.
So another question. I always wondered this. So how do bones get out of place?
Well, they go out of place in a lot of different ways. First of all, the first trauma in life is birth, they say. If the head is twisted in the shoulders to get out of the vaginal canal, that can cause some issues. But the average child up until the age of 12 years old falls 1,000 times. Think about it. Learning how to walk, run, jungle gym, swings, things happen. Kids fall. And the bones go out of place through that way. That's what they call macro trauma. A fall, a car accident, all the above. But let's say these bones go out of place when you're 5, 6 years old, and you keep on running, walking with these bones out of place. Let's say your leg is half an inch off. It's kind of like the alignment in your car. If your alignment's off, your wheel's going to wear off faster. So what happens is we get more mature or older, we get less resilient. We need to stretch more, all the above, but then we find these things start to catch us. But it's not that we're getting old, it's that these bones are going out of place. It's like the straw that breaks the camel's back. So that's macro trauma. But you also have micro trauma, which is doing something the wrong way over and over again. For example, this is the reason why ergonomics is very important in the workplace. If your computer screen is off to the side, it should be straight, and you look to the side for 8 hours. Even if your television screen is that way, you sit on your couch, that's going to cause the bones to go out of place over time. Sleeping incorrectly. There's a lot of different ways that the bones go out of place with just little small things. If you play tennis, baseball, golf, swinging in one direction over and over again will cause tightness on one side of the body. If you notice the first time you play these sports, you might be sore only on one side. And so that's how the little things done over and over again called microtrauma will make the bones go out of place also.
So in baseball, switch hitters, they have it good, huh?
Yeah, really, really good.
That makes sense. Okay.
Exactly.
All right.
Good for business.
Yeah, good for business. All right. Okay, another question. So how do you evaluate the spine and problems?
Well, we use a lot of different techniques and methods to evaluate. I'm a type A person, so I want things to line up a lot of different ways before I decide what the main cause is, and evaluation from the root cause. For example, in a routine physical, what we'll do is we'll do a static palpation, which will actually feel where your bones are, what's misaligned, what's raised on the body. For example, for me, it feels like there's a big bump underneath, let's say your bedspread or a rug. It's like a bowling ball's underneath there. So it's raised up. If it's in my shirt, you see it poking out. So those things are very easy to detect with me. But also there's a motion palpation we do, which we see how the range of motion is. How far can you move your neck side to side? How far can you rotate your body? We also do a test to see how the pelvis and your sacrum is moving, your tailbone and your hip joints. Then we also do a postural test. So I'll put you on scales and we'll see how your feet are measuring your weight from one side to the other. I'll see if one shoulder is higher than the other, if you're tilting your head. And we also do a digital x-ray, which is very non-invasive. There's not very much radiation. You get more radiation going through the TSA at the airport than you do with this machine. And so we put all those things together, as well as a thorough history, finding out what your past sports history would be, car accidents that you might have had in the past, a fall, a broken leg, which you were favoring one leg on crutches. All those things make a big difference, and why I spend a lot of time with the history, because that's going to tell me a lot about what your future is going to look like and how we can coach you into better health by evaluating the spine, fixing the subluxations, and then giving you good homework to do after you leave the office.
Okay. That's very interesting.
Yeah, very thorough.
Yeah. Okay. Now, this is a question I've always wondered. Okay. So, what makes all the popping noises, and why can't I just, adjust my own neck and back by moving?
Yes. Well, there's a reason why we go to school for 4.5, 5 years to learn how to do this properly. Each bone has 14 different places where it articulates. So that means where it joins together. Each bone, when I adjust your bones, I use different vectors of force. On a Cartesian plane coordinate system with an axis and a graph, you have an X and a Y axis. But you also have a lot of different vectors going through diagonally in all different directions. So when we adjust the bones, move the bones back into place to correct the subluxation, you might hear a little popping sound. It doesn't always have to pop, but what you have is a little gas called nitrous oxide inside the synovial fluid, which is a lubricating fluid around your joints. Think of it like the bubbles in a Sprite can. When I adjust the bones, some of that gas is released. But now, when you try and pop your own neck, What you're doing is moving the bones to in place, out of place. Okay, I had a physical that I was doing on somebody, and I had them checking their range of motion, check their neck through that static palpation I was telling you about, and they popped their own neck. When I first checked them, they had 6 bones out of place, but after they self-corrected, they actually had 8 bones out of place. So right then and there, he moved 2 more bones out of place by adjusting his own neck. So there's actually a guy in Canada in 2017 that died from self-correcting, doing one of these numbers. Okay, people bend over a chair to pop their back. You can actually fracture a rib, and that can actually puncture your lung also. But the point is, an adjustment is done in a paraphysiological space, meaning a range of motion that you do passively. Just like if somebody stretches you, and they can stretch you further than if you are stretching yourself. Just like you can't tickle yourself. Don't try that right now. But the point is that these things are done by somebody else, and it takes a lot of skill and training to be able to do it properly and do it effectively.
I'm guilty.
That's all right. I'll fix you.
Okay. All right. So after hearing all of that, okay, question is this: is it safe?
Absolutely. Safe for everybody from 6 minutes old to 96-year-old people I've had in here. The point is, and I know I'm a big guy, but I'm a gentle giant. I like telling people, a good adjustment is not done with a lot of force. It's mostly speed and setup. So I do a lot of work to loosen up the muscles first, so the adjustment's a lot easier. But the point is that the average medical doctor pays up to $350,000 per year in malpractice insurance. Take a wild guess how much chiropractors pay.
Not nearly as much as that.
No.
He is the most interesting man.
Let's see.
And I know you
8,000.
8,000. No. Less than $1,000 for the same amount of coverage. So in other words, in this society today, we're real litigious. If we were actually causing harm, we definitely have to pay more. The fact that it's less than $1,000 can tell you a lot. There's more chances of something happening in a dentist's chair or at your hairdresser's than at a chiropractor's office. Did you know that? There's more chance of 2 737 jets meaning nose to nose in the middle of the air. And we do a thorough history in our evaluation to rule out any type of heart issues. And there's lots of different techniques to use for people who do have heart issues. But it's a very, very safe practice. Matter of fact, the American Council of Physicians came out in 2017 and said that the most effective form of treatment for neck and back pain is chiropractic care. And it's definitely more effective and has less side effects than some of the drugs out there if you read the labels.
Yeah, that's really interesting because, like, when I came to you, I had numerous issues, and as soon as you adjusted me, well, after a couple of sessions, you know, I felt like my energy was flowing right. You know, I even felt more clarity.
Yes.
You know, and even, you know, I'm active. I do martial arts. I play baseball. I was able to maneuver better. You know, and I remember one time I was pitching, and my neck went out of place, and it felt like I had a pinched nerve. And I came to see you. And you fixed it, and I was actually able to play that upcoming. It was like 2 days later. You know, I wasn't 100%. I kind of
Right, of course.
Yeah. But no, if I wanted to come to you, there's no way I could play you. I know that because I was like this.
Yeah, and that's what people do over time. Is the pain doesn't go away; they just compensate for it. You can't turn your neck, so you turn your whole body, and so that's where we want to be proactive about this. But also, we'll be honest with athletes. Sometimes you have to get out there sooner than you want to, but it's all about the maintenance of care after the fact, also.
Yeah, makes total sense.
Absolutely.
You mentioned earlier that you've had babies to 96-year-olds. So what's the range of chiropractic care?
Literally everyone. I've had 6-day-old babies in here. I've had 96, 97-year-old people coming here. There's a very broad range, and it should be more about prevention, which we'll talk about also. It's kind of like, at birth is really the first time to start. My last 2 children have been adjusted since they've been born, and you want them to grow up straight. They're going to fall, and you don't want them to wear out like the alignment in the car, like I was talking about earlier. Think about it as a vine that you want to train. If you let a vine go, it's going to grow all over the place. But if you put it up against a stick and help train it, it's going to grow in the path that you want it to grow. So with the spinal line with children, it's very important to start and then go all the way up too. But there's no wrong time to start. I always tell people in their 20s and 30s, it's a good time they came in, because if they don't come in during that time, Then they go down the allopathic path where they might go with more of the drugs, surgery, and physical therapy, which is not a bad thing. It all works. The physical therapy works together with the muscle, but you have to align the structure as well. So you really want to make sure that you start at a young age, but if you're not, it's never too late, because you don't want to wait until these things happen over time. So athletes often use chiropractic care because they want their optimal performance. Kobe Bryant, for example, had 2 chiropractors. He had one near his house and one near the stadium, Staples Center. And of the 32 NFL teams, 3 of them have team chiropractors. So think about it. You have these $1 million athletes, and they want to perform the best. And it's an investment by the owners as well. And so they want to make sure that they're working as best as possible. So for injury prevention, as well as for recovery from injury, athletes use chiropractic all the time. I have several NFL players in here, Olympians, and they all want the best out of their bodies, but also don't want to wait until they have an injury in order to get care. So to get the best out of their body and to really have preventive injury maintenance and care, they all come to the chiropractor.
That makes perfect sense. I mean, where else, as far as somebody getting your body in line from head to toe, you basically specialize in all of that, right?
Yeah, and then you also want to think about it as an investment in your health as well, because what you do now, well, you're going to reap benefits or the negative consequences 20, 30 years from now. So if your spine's out of place, for example, if you don't exercise, you go weight, you can have more heart disease, diabetes, all those things happen. They don't happen overnight. So by taking care of your spine now, you avoid a lot of the problems later, what they like to call arthritis, or degenerative disc disease, or degenerative joint disease.
So keep the vine straight.
Keep the vine straight.
I like that.
So another point to be made is that it's kind of like your car. If I tell you your timing belt is a little bit frayed, you don't want to wait till it completely pops. You could be on the highway, you could be on your way to your interview, you could be in the rain or the snow. So we want to, again, be more preventative about how you think about the body, how you think about your health, and also realizing that little steps to a smaller goal, and that's why we call it the transformation. It takes an average of 2 years for your body to really start holding on to the alignment. I'm not saying you need to come in 3 times a week for 6 months to get there. The initial person, when they first come in, needs to come in a couple times in the first week, in the first month, to really start to get the body retrained, because the body's been used to being out of place. And so we have to create a new normal for the body, get it used to not putting more weight on one side of the body, not tilting your head and all the above. And that way, we have to create a new system. But again, it takes about 2 years for that really to start holding on. And then eventually you get to about, twice a month after about the first month or 2 of care.
Wow. Again, it makes sense.
Yep, stay proactive.
Okay, so this is something I personally have always kind of been interested in. It's like, so I know there's different ways you can do it. So what techniques do you use?
Okay, well, I tell people there's over 200 chiropractic techniques. I use between 8 and 14 in my session because everybody's different and people respond to different things. There is a technique, chiropractic literally means with hands, okay? So some people use instruments, some people use both. The combination, and for example, with a baby, you're just going to use your finger and just touch it gently and the bone moves into place. There's no forceful manipulation or adjustment of the spine. Then we have what's called the activator, which is a small tool here, and what it does is you has a spring in it, and you just click it like this, makes that sound, and that actually moves the bone.
He is the most interesting
Just
man
like
in
that.
the world.
Okay, but I use a drop table. I do a lot of extremity adjusting, so I actually work on your knees, shoulders, all the above, because it makes sense to me. Because if your back's out of place, but your knees off or your ankles off, then your back's not going to get better if your ankle's out of place. Same thing with the neck and the shoulder. This is the only joint that connects your shoulder to your body, called the sternoclavicular joint. So I like adjusting everything to help look at the whole picture. For me, it's like kind of washing the car without washing the windows and the wheels. It's not clean. So I like addressing the entire body and making sure that we get the alignment together, but also looking at the whole picture. We use a technique in here called the Pedibond technique, which actually does traction therapy. We have spine decompression also. But the point is, we can adjust the bones, put the bones in place. But to get the disc space, the space between the bones to increase, to stop that degeneration, to stop the arthritis, we do a traction protocol here. We do 15 minutes of exercises to get the spine ready, get the spine lubricated, get the lymph flowing, and then we adjust the body.
Okay, so chiropractors, I know through time, especially dealing with you, all the doctors like any other doctor. So could you talk about the training that you had to become a doctor?
Yeah, the training is actually a 4.5-year program. I went to Life University, and it's actually been shown that chiropractors actually do more schoolwork and training than medical doctors do. We dissect bodies as part of our training. Also, for myself personally, I got a master's while I was in chiropractic school, so I have a master's in sport health science, focused on sport injury management. So I also worked in physical therapy for 9 years. Also, I'm a certified conditioning specialist, which is a step above personal trainer. Learn a little bit more about the physiology behind the muscle and how the body works. But chiropractors, we take everything from growth dissection, explain anatomy and physiology, visceral diagnosis, ophthalmology, the senses, orthopedic testing. So it's a very broad range of topics, including embryology. There's a lot. We use a lot of the same textbooks that medical doctors do as well. But our training is more focused on looking at the cause, and not necessarily diagnosing problems. There's a time and place for everything. There's time to refer to a medical doctor. There's time for physical therapy. There's time for surgery. But we like to start with this least invasive process and look at the body. And a lot of times the body can help heal itself if you put it in the right position. But then again, it's good to know, to have the training to know what's normal, what's abnormal, what's outside of our scope of practice.
That's interesting because ever since I've been, I do karate, I would, work out, I lift weights, and I play baseball. And even with any of my injuries, as long as I've been playing and knowing you, I've never had to go to any doctor that just came to me.
Yeah, I mean, a lot of people will say, especially people that have been with me a long time, or people that have gone to the medical doctor and then come back, they will say to me, well, I'm going to come to you first. And then if that doesn't work, then I'll go there. And those people are more motivated because they'll do the stretches. And sometimes you have to rest, and that's a big part of it also. Listening to your body, getting that awareness. Whereas if you mask the pain with certain anti-inflammatories or drugs, again, you're not fixing the problem. And then it also makes you think you can do more than you can do. And then it causes more problems in the long run.
All right, well, thank you very much, Dr. Jason Regis. It was wonderful, coming to see you. And it looks like what we're going to do now is he's going to give you a short example of what a chiropractic session is on me. This is something I've been doing for 7-8 years, so we'll give you a sneak peek into, what really goes down in the chair. All right, so we'll be right back with you.
So first thing I'm going to do is check, turn this way, check and see how the tailbone is moving in relation to the pelvis by marching. So go ahead and bring your right knee up like you're marching. Good. And left, right, left, right, left. Good. Turn it this way for me. So I see that a little bit has the right tailbone out of place. Turn the other direction. Good. And the left hip is out of place. Good. I'm tilting. Okay. Next one I do is come around and sit on the table here. I'm going to loosen up the spine.
He is the most interesting
I'm doing
man
some
in the
gentle
world.
stretching. So first thing we do is stretch out the chest muscle a little bit. That's tight.
This is lifted.
This is going to loosen up the muscles.
That's my bad show.
Yeah, I see. Any pain with that?
No.
Okay.
I don't ordinary. I need to relax.
So you need to live on this street right here. lay on your back.
He is the most interesting man in the world.
Okay. Bend your knee for me. Good. Nice and easy. Push. And relax. About half as much pressure. Push again. And relax. Got even less. Push. And relax. Hip jammed in the socket. This will cause hip replacements. Flipping over your stomach. Okay. This is left hip. Leg up here. Pull your knee down to the table. And relax. Again. And relax. One more. And relax. Go. Now we'll get you to loosen the spine, warm up the tissues, the blood flow, and also calm down the nervous system. The Cox flexion distraction table. The table is going to bend in half to help stretch out the spine and get the fluid moving back up through the spinal cord. And this is a vibrocussor. This helps loosen up the muscles, increase blood circulation as well. But also, just like muscles have tone, the nervous system has a tone, and this increases your neural tone, gets the body ready for the adjustment. You okay? I did my thesis in my master's program in vibration therapy, actually. So this is not the one you're going to find at Target or Walmart. Or online. You have to be a chiropractor in order to order these.
He is the most
There's a lot of them out there, but some
interesting
of
man
them
in the
don't have the
world.
right frequency and actually can break down your muscle tissue. Alright, so you're going to feel where the bones are. Spine here. Okay, you have a subluxation here in the thoracics and the mid-back area. Breathe in and out. Good. Relax. Alright. Another one here. Breathe in and out. Shut up a little bit. Good. Okay, low back, lumbars out of place. So, let's turn on your side face feet. Take down a little bit so I can protect my back. Yeah. Alright, breathe in and out. Good. Okay. On your stomach. So another way we can adjust the low back is using a drop table. So you set the tension on the table. And like gravity do the work. See how much tension needs to drop. Good. Hold it. Good. And you can just guide the bone into place. Good. Do the same thing with the neck. Bring that table up here. Just guide it in place. Or turn your head to the left for me. We can use the activator. It's a little tool. And that can move the bone as well. Head straight. Okay. Now we're going to check the ligament that attaches from the pelvis onto the bottom of the rib cage, called the quadratus lumborum, with the QL. And we'll do some muscle testing. This tests the body's proprioception, its awareness of where it is in space. Check this other side. Good. Okay, you can flip on over for me, please.
He is the most interesting man in the world.
Okay. Now we'll check the joint for shoulder. Let's check the shoulder. Alright, let's see if the shoulder, this is the only thing that connects your shoulder to your body, your sternum and your clavicle. Hold your arm, don't let pull. Okay, wow, that's out of place. So put your hand behind your back here. And this on the table. See how much tension you need. Joint is where the clavicle meets the shoulder blade called the acromion. Here. Good. Alright. So now arm straight. Hold. Good. Hand behind the back. Good. Check out the shoulder, see if it's going forward and backward in the socket. Check the elbows. Good. And hold and pull. Very good. Now pinky and thumb together. Hold it. Hold that finger. Good. Okay. Same thing with the other side. Alright. Arm straight. Hold. Good. Hold it here. Oh, wow, that's out of place. Okay. So shoulder's partially dislocated out of the socket. So it's going to give a nice little gentle thrust in there. Good. Hold. Nice. Strong. Bend your elbow. Hold. Behind your back. That's why rotator cuff muscles are so important. Help the muscles attach to shoulder. So helps with that alignment that we keep talking about. Okay, elbows out of place. Good. There. Don't let pull here. Okay, your bicep tendon's out of place too. So the bicep sits in the groove of the shoulder. And when the shoulder moves out of place, so does the bicep.
He is the most interesting man in the world.
Good. All right, pinky and thumb together. One pull apart. Okay. Let's try it again. Do the next finger and thumb. Nice and strong. Okay, so that tells me that the lunate bone, which is the bone sits on top of the carpal tunnel region, is out of place. So I feel use the activator. Again, the blood and nerve supply goes through this tunnel into the hands. All right, pinky and thumb together. Good. Nice and strong. Perfect. Yep.
Like noon.
Through your hand. So a carpal tunnel surgery is not that successful. Then they start cutting on the elbow, and they start cutting on the neck. Well, they start saying it comes from the neck. Alright. Your toes. And then knees and ankles. Okay, ankles out of place. So if you ever sprain your ankle, you might not have the bones too. There we go. Okay, and the knee is also out of place here. Good. Alright. A little small bone that goes on the other side of that knee. Alright, and then the knee joint here, still here. This ankle is also out of place.
Doc, I don't remember being in a car accident.
Sure feels like it. Maybe hit your head too. Alright, his knee alignment's off. The knee's supposed to be lined up. It's just to the side. That's why you see a lot of people with knee braces on, or the knee, that little band goes around the knee. Let's try and correct the problem. But really, the problem is the alignment. So, right here, it's a little mini drop table. It's got a mini version of the big table that it was laying on. Just drop it in place like that. There we go. Nice. Okay, and that's it.
Yeah.
Okay, that's it. Coming up. Don't sneeze. I'll lift you all up. All right.
I can already tell you now, my neck feels better,
He
my
is the
shoulder,
most interesting
just from
man
that
in the
little
world.
adjustment, I feel completely different. And this is why I keep coming to this man right here. Thank you very much, Dr. Jason.
Thank you. My pleasure.
All right, and see y'all soon. Thank you much.